Hello, welcome back to Mirror Interpretation Todorova's page. My name is Ioana and I am an interpreter, and I am making this video series class called Cardiovascular System. Again, thank you for following, subscribing, liking, and commenting. I remind you guys, this is a video for a medical terminology that we need in our interpreter encounters. I repeat, these classes are not for medicine. These classes are just a general knowledge of a medical terminology for interpreters. Okay guys, so in our first few videos we talk about cardiovascular system, and we start with the heart, then with the veins, what the heart does. What the heart is: the circulation of the blood that come in the heart and out of the heart. You can click on the links above or below, I don't know where they're gonna come, and check these videos out to repass your medical terminology in English. So today I'm gonna continue talking about the cardiovascular system, and I have prepared two classes, and the reason that I make them together is because we often confuse those two things, and I put them together in order to help our brain to remember it. So I'm gonna start to talk about the heart rate, in particular what is the blood pressure, the most common problems with the blood pressure. Okay, let's start. So a heart rate, and what is a regular heart rate for an adult, is between 60 to 100 beats per minute. The children have a little bit higher blood pressure, about 70 to 100, but after age of 10 is considered that they slow down to the normal heart rate. High blood pressure is when I'm sorry, we're not gonna go. We're gonna talk what the blood pressure is now. So the blood pressure is the circulation of the blood thanks to the pumping of the heart and the pressure the blood creates with the inner side of the veins. So let's repass back. We had this class, it was the last class that we were talking how the veins or the main arteries are structured, right? So we had like a circle in our class, and the inner side was called intima, which was the side of the vein that was closer where the blood flow is. This is the side where through the blood pump, the blood come out and exercise pressure to the veins, and this is blood pressure. Or as they said it in the book, that's the pressure of the blood inside of the veins. Okay, what is systolic blood pressure and diastolic blood pressure? Okay guys, I as always make a small painting for you because I love doing those. These paintings, if you want to call them painting or drawings, help my brain to remember a lot of things. I know guys, it takes a lot of patience, but trust me, if you do those colors and those painting like a little kid, your brain get involved. So I had created this diagram for you. It's like a small painting you see, as you see it on the monitor when they monitor your heart rate. So let's start our first terminology. It was a systolic blood pressure. The systolic is when the pressure that the blood exercise in the veins when the heart is pumping. When you see this line, this is when the muscle is pumping and contracting and sending the blood away from the heart into the veins, into the arteries, and this blood is exercising pressure to the veins. In the moment the activation of the heart, when the muscle is working, is called systolic blood pressure, because this pumping is called systole. And diastolic blood pressure, as you see here in my graphic, there is this almost straight line, but they are not straight. It's the blood pressure when the heart is not pumping. So normally in the normal heart rate, we have pump and relax, pump and relax. So basically, when the heart is relaxing, this means that the muscle is not contracting, but during this process of time, our heart gets full with the blood, and when it gets full, the muscle contract and send it out. So this is about systolic and diastolic blood pressure. Okay, let's see if I missed something. Okay. So the systolic is basically when the time heart rests full with blood and gets oxygen. So let's talk about what is normal blood pressure and when to worry about our blood pressure again. This is just a general talk, guys. Remember, I can make mistake. You need to have a general knowledge. You don't need to explain anything to the patient as an interpreter. You just gotta make sure that you understand the doctor. Okay, I'm just giving you a general knowledge. What is normal? Systolic less than 120, disystolic less than 180. So normally the systolic blood pressure is our top and the disystolic is the bottom one. Let's say 120/80. This is how they measure it. Elevated blood pressure is between 120 and 129, but less than 80 on the systolics. High blood pressure, it's when the systolic is 130 over or between 130 and 139, and the systolic is between 80 and 89. And hypertension or hypertensive crisis is when we have higher than 180 of a blood pressure and of a systolic and higher than 120 on the systolic. But anywhere after 130 and after 89 on the bottom, this is alarming moment. So the blood pressure could be alarming for our health and for our healthy condition. And when we have a super high blood pressure, I will give you 1, 2, 3, 4, 10, eventually 10 symptoms of a high blood pressure, which mean that it's more than 130/80/100/90, and this means that we have to call a doctor or we have to call 911. So the first symptoms, I repeat, guys, this is the most common one. It doesn't have to have it all, but if you have a lot of those symptoms often, you gotta consider consulting your doctor or calling 911. Normally, as an interpreter, these kind of symptoms and this kind of terminology that I'm gonna use right now are used when they question the patient about their state of healthy. So, symptoms of a high blood pressure, number 1, you have a headache. Dull or consistent headache, it could be a sign of a high blood pressure, especially if you have a headache on the back of your neck or on the back side of your head. It's similar to stress headache, but it's a little bit more persistent, more stable, more different, right? Shortness of breath. Especially older people, when they climb stairs, when they walk, when they don't exercise too much, they have shortness of breath, especially if they have to run or do some kind of a physical activity they are not used to. Chest pain. Okay, chest pain could be indicator of a high blood pressure, but it's not always obligatory that you're gonna have a high blood pressure. Could be many things, but for example, if you're hypertonic, this high blood pressure can damage the arteries, and create enlarged heart and so on and so on. So in general, chest pain, it's if you feel tired or exhausted as well, this is number 4. If you have, for example, very stressful schedule, that could be also the result of being super tired. But normally, if that's happened often and you don't have such a, let's say, intense schedule, that could be also a sign of a high blood pressure. Okay, nausea. Let's remember that the nausea could also be a result of overeating, food poisoning, ulcer or a gallbladder disease or anything else. But if we have often nausea with other symptoms, it's often related to a high blood pressure. Poor vision or a blurry vision. Do you have a blurry vision or anything like that? So the blood pressure can affect and create eye disease, because, for example, if there is an extra pressure on the cornea of the eyes, that can create some kind of problems on the retina and so on and so on, that can result in the vision. And there is something called hypertensive retinopathy. This hyper or overflow or very strong pressure in the eye retina creates this problem. Okay, number 7, ringing in the ears. Okay, so sometimes when the blood pressure flow is strong and come to the head, can create a special buzz that sounds like a ringing. Okay, so if we have this strange ringing, that could be another symptom. High blood pressure can cause, and especially if it's very high, we're talking about very extreme cases, confusion or distracted or not related speech. This is very serious symptoms that we can look in people. This means we need immediately doctor. But also this confusion could be created from another things like ictus and so on, so on. But again, another thing, number 8, bleeding of the nose. It's not obligatory that we do have the high blood pressure, but sometimes the bleeding of the nose and the high blood pressure are related, because when the pressure is so much, this create an extra flow and make the blood move more quickly, basically, right? If we have a high blood pressure and we don't know and we don't take care of this problem, this can create damage of the kidneys. I remember the high blood pressure can create a lot of problems with a lot of organs, but because of the blood vessels that supply the organs with the blood, we can have a damage of a blood vessel that supplies the kidneys, and we know if we have a problems with the kidneys, that create a very complicated health problems. Okay guys, that was video number 3 of cardiovascular system and our heart rate and our blood pressure. I'm gonna create another video number 2 right after this one, that I'm gonna talk about the heart rate and arrhythmia. I'm gonna describe the difference between the heart rate and the pulse, and I hope you enjoyed this video. Thank you for watching. Thank you for being here. Thank you for liking. Please subscribe, share, comment. Thank you for being here. I hope you have a wonderful day. That was everything from Denver, Colorado. Take care and bye-bye.